Community of students lets its guard down just for an evening. Parents, families, students, help us all help you. I want nothing more than to keep schools open and to be as normal as possible with instruction and the activities that happen at our high schools and middle and elementary schools. But if you choose to take risk outside of school, or even in school, it will have an impact. For your safety, for the safety of your fellow students, and for the safety of your teachers and staff, exercise healthy behaviors and healthy habits. Avoid risky situations, and let's keep schools both open and as safe as we can make them during this pandemic. It is my pleasure to introduce Dr. Roll and to say thank you to the Department of Health for all the work they are doing to help our schools manage so well in this pandemic situation. At this time, Dr. Roll.
Good afternoon, and thank you, Dr. Green. So the Florida Department of Health in Duval County is working very closely with Duval County Public Schools, as we have done since the pandemic started. They have instituted, from the beginning, a number of precautions, and so we continue to work very closely with them. What we ask from the community is, like she said, help us help you. Cooperate with the investigations. Also cooperate with the recommendations that she's given. A lot of what happens is because of our natural behaviors. We all want to get back to normal. We all want to resume a lot of the activities we once had, but that in itself can be risky, particularly if we don't socially distance or wear masks when it's appropriate. So far, what we know about the cases. Right now, it appears that they were all linked to outside activities, including a party, as well as smaller gatherings at individual homes. In addition, there has been transmission noted within households. With that, students bring COVID to school. I want to commend DCPS for all that they've done in notifying everyone, making sure everyone is appropriately aware. But again, we need the community's help. We're not here to do harm. We're here to help. And so I ask that if you are familiar with the situation and you think you might have been in contact with someone who has COVID, please give the Department of Health a call at 904-253-1850. Again, that's 904-253-1850. When my investigators from the Florida Department of Health call, please be cooperative. It is extremely important that you answer our questions and be truthful with us. That is the only way we are able to help protect the community. Unfortunately, we understand there are scams out there. So certainly if you feel uncomfortable, hang up and call us back at that number I gave earlier. And say that I may have been a contact to a positive, and we'll connect you with someone. We do our best to maintain the confidentiality of all cases involved. So please don't be afraid to speak to us. We've gotten feedback from the community stating, I don't want to be a snitch. Please, this virus is deadly. Don't view it that way. View it as helping others. We need you to help us. Again, I'll emphasize prevention, avoiding crowds, social distancing, and wearing a mask in areas where it is appropriate to do so. If you are a contact, you will be expected to quarantine for 14 days, even if you are negative. Please understand that. If you're a positive, there are different parameters for you, including you will need to be without fever for 24 hours, have a reduction in symptoms, and at least 10 days will need to have past initial symptoms started, or if you are asymptomatic, then it must have been 10 days since you had that positive test result. Again, confidentiality is important. We maintain your confidentiality. The details are important. Also, keeping you safe is important. And I can tell you, thank you to DCPS, this could be much worse if they had not done what they've done. If they had not been good partners, this could be much worse. And so we're hoping it will not be worse. Again, Dr. Green will give further instructions as we continue this investigation, have a better understanding of how many people in the end are actually affected. That will determine the timeline for how things roll forward. So we thank you for being here today. And our press is a part of that mitigation of spread in the community. Thank you.
either Dr. Green or Dr. Roll, is this considered a super spreader event? How many people were at the party?
So we do not have those details, and I can't say whether there's a super spreader. Anyone who has COVID-19 is contagious. We deem anyone to have COVID-19 to be contagious, whether they are symptomatic or asymptomatic. In this case, we found a good number of the folks were symptomatic, but we do have some people who were asymptomatic.
Are those numbers all students?
No.
Okay.
As I stated earlier, there are families that are involved.
But are there faculty or staff members at the school involved now
Yes.
that are sick?
Dr. Rowley, you spoke about challenges when conducting the contact tracing, specifically with regard to people cooperating. Can you speak a little bit more about those challenges and what you've been seeing as that process has been underway?
Certainly. We've had a good number of folks who have been very cooperative, but when parents have teenagers, oftentimes they don't get good information from their teenagers, and they become very frustrated with us when we're asking questions. In some instances, parents know they just don't want to say because they're afraid they're going to get somebody in trouble. You're not going to get in trouble. This helps the community. And so folks are sometimes reluctant to answer our questions, and we'll say, no more questions, I'm not talking to you. Or they may be afraid that it's a scam, and so that's why I recommend that folks call us.
So the 27 number, are those students? You said 27 positive?
That's combined,
Students and staff?
yes.
Okay.
That's including the cases that were confirmed prior to yesterday?
Yes.
Okay, thank you.
So that includes the 6 that are currently on the dashboard?
It would be in addition to the 5 that were on the dashboard before yesterday.
Okay.
So there were 5 previous to this event, and the 27 is beyond that.
I have some questions for the superintendent, if that's okay.
Yeah, I have a question as well.
Given the proximity of Fletcher High to San Pablo, which is also seeing a sort of a higher number of cases than normal, has there been any exploration as to the question of closing down any other campuses or scaling back or anything like that?
If you would remember, we have a matrix that tells us when we would close a school or when we close a classroom. Fletcher High School is on the matrix that it has the potential to impact 20% of the student body that attends brick and mortar. So that is why we made the decision we need to close Fletcher. Once DOH finishes their contact tracing, we hope we will know that information before Monday. That will determine whether the school has to remain closed for a longer period of time if it meets the threshold of more than 20% of the student and staff body have been impacted.
So currently, it's not known what level of impact there is at Fletcher?
Currently, yes. It is not completely known the total impact.
And quick question, a lot of parents and families rely on that COVID-19 dashboard. Mm-hmm. Do you think there's too much time in between it updating? I know just now we heard 27, but currently on the dashboard there's only 6.
Yes. Our dashboard is normally updated when a case closes. And a case closes once that contact tracing is done and we know the total number of students impacted. And so, yes, it lags. And we've had that conversation today, and we're trying to figure out how can we get information out quicker, but make sure the information is accurate. Just because we receive a call that someone tests positive, that doesn't mean they are actually COVID-19 positive. We have other situations where they've done maybe antibody testing and it came back. That doesn't mean the individual has COVID-19. So we have to filter that information out. DOH, they have to accept the case and then do the contact tracing. So now we're looking at possibly, should we post when DOH says this is a case and we're taking it? Then we can post. But our families will need to know we're posting it before the contact tracing has been completed. So we will not know how many students are impacted.
So those 27 cases you just mentioned, those are reported with the DOH?
The 27, yes, but they're still in the midst of investigating the contact tracing, and that's why they don't show at this time. But as I stated, we're having conversation, and we may change our process to start reporting once DOH has accepted the case.
Are you satisfied with how you handled this entire situation?
I'm satisfied in us following our procedures. I'm satisfied in the school. Mr. Ledford, his team was at the school today for students who needed laptops, hotspots. I'm satisfied in us following our procedures. I'm not satisfied in that we are in a position that we had to close our school because of activity outside of the school. And I want our students to understand that we know you're back in school because you miss your friends. We know you're back in school because you love Friday night football. You love all the events that are related to your school. But now all of those things have been canceled, and it's because of activity that happened outside the school. So we need them to do the same things that they're doing when they're at school. Please do those same things when you're doing things outside of school.
Is there any word yet on if you're going to extend past Monday for Duval homeroom for Fletcher High School?
That will depend on the contact tracing being completed, and does it impact more than 20% of the student body of that school and the students who attend brick and mortar.
So does that mean between the lines that 20% of the students are in quarantine right now?
No, DOH has not finished their contact tracing. So when they're finished, if we have more than 20% of the students that have to be self-isolated or quarantined, it requires the school to remain closed until DOH tells us that this is the date they can reopen.
Do you have any numbers about people in quarantine?
Our numbers would just be DCPS numbers, and we rely on the Department of Health. So I would be giving you information that has not been verified by the Department of Health. But those numbers gave us pause and gave us concern. We contacted DOH and collaborated and said, if we close the school until Monday, will that give you enough time to help get to a point that we can say, we'll be extending it, or no, students can come back on Tuesday, with the exception of those who must be quarantined.
And we know there's an incubation period. When was this off-campus gathering supposed to have taken place? Because that could possibly affect the timeline here. Was it Friday? Was it Saturday?
I personally don't know when this off-campus social event took place personally. My guess it would be between Friday and Saturday.
What message do you have for students who are maybe going a little stir crazy and want to get together with their friends and not really taking COVID seriously?
For our students, they have been coming to school and following our protocols very well. They need to implement those same protocols outside of school. No one is telling you you can't see your friends or you can't attend events, but you need to ensure that you're wearing a face covering, you're frequently washing your hands, you are keeping social distance. The same things that we are doing inside of school, they need to implement outside of school.
For families sitting here watching this and a member of the family is perhaps symptomatic, what should the thinking be at this point right now?
If a family member is symptomatic, if it is a student, we encourage you to contact your school. You can get the form to go get free testing at the 4 sites that are on our website. If they are a faculty, an employee, we encourage you to go to any one of our 8 rapid testing sites and get a test. We offered that rapid testing for all of the employees at Fletcher High School, and more than half of them took advantage of it.
So the main message today, though, again, is just responsibility when you're outside of school as well.
Yes, that is the main message. Show that responsibility for the safety of yourself, your family, your friends, your siblings. The impact goes far beyond Fletcher High School. We also make siblings self-isolate, so that could impact the middle school, the elementary school. It's far-reaching.
Any other questions? Appreciate you guys.
Thank you so
very
much.
Thank you all.
And this would be the biggest outbreak in DCPS? Yeah. Sorry, within a DCPS school.
Haven't been able to get it fixed yet?
I know all too well how that is.
I got
Okay.
Feel that?
Yep, please.
Double check though.
Yeah.
Hang on.
What about the
30.
30, that's me.
All right, cool.